Welcome to CareTalk at Health 2019, a special series of CareTalk that we are shooting from the Health Innovation Conference here in Las Vegas. Well, today we're upgrading a little bit because we got rid of CareCentrix CEO John Driscoll, and we just have myself, David Williams from Health Business Group. We have two guests, We have Dr. Scott Shreeve, he is the CEO of Crossover Health, and we have Dr. Jay Parkinson, who's the Chief Designer or Chief Design Officer. I just gave him an upgrade.
Yeah,
I don't know if he has to give him I hope that doesn't come with a raise and a few options as well. So I don't know what that is. All right. So listen, you throw a lot of jargon out there, Scott. So there's something about this connected system of health. I mean, what is that anyway?
Yeah. Well, it's a new conference. You got to have a new slang, new jargon.
Have something.
Yeah. So.
But you put vowels in your spelling of health. So I had a little trouble reading it.
I did. So. So what we're talking about is we've, for the last decade, we've been considered to be an on-site, near-site health provider working with large employers exclusively to bring better primary care closer to their campus, make it more accessible, make it relevant. What we've realized, though, over that last decade is that we're only addressing the needs of maybe 20 to 30% of the population of the employers we serve.
Right.
And they're expecting us to actually have a solution that can reach all of their population. And what we've realized is that we've needed to add digital capabilities, a digital first approach to what we're doing.
Just like America First.
There you go. Yeah. That's right. Make digital great again, right? So here we go. So, but yeah, adding the digital capability allows us to reach more of the population. And beyond that, we've also realized that you need to add additional capabilities to the primary care team. So care management, care navigation, these other services. And when you put that all together for an employer, it is truly a connected system of health across the country for their entire population.
All right. So listen, when we talk about digital first, is that sort of just like getting a demand management computer in the way of keeping people away from the, digital first? It's like, I want to see the doctor, and they're like, well, digital first.
There we go. That's my opportunity to explain. Everyone actually understands digital first because you carry your care team with you in your pocket.
True enough.
What we mean by digital first is that your first access point is to reach the care team by the way you access all the other people you're trying to intervene with. So if I have a different medical condition or whatever, I can directly link to my care team. They'll respond back to me. They'll try to take care of the situation if they can online or strategically bring you in person as needed. So that digital first approach allows us to go to a much broader audience. It's actually, the patient population we serve is very amenable to that type of care, and it's been a dramatic impact in our ability to reach more of the population we've already been serving.
Got it. Now, when I first met Chief Digital Design Officer 10 years ago. It's like when the iPhone came out, within a week he started a business saying, I don't need a doctor's office, I'll just have my phone, I'll just crash at the local coffee shop.
Full circle.
So how did we get from there to here?
It's funny because I met you then and I met Scott then as well. So it's really fascinating.
He hired you.
Well, 12 years later, right?
Yeah.
But no, it's just kind of, to me, an obvious thing. Life is just changing. I mean, we're just using our phones. We're mostly asynchronous messaging with people. So it's like, why not bring that to the doctor-patient relationship? It's a no-brainer now. 12 years ago, it was cutting edge. But, finally, the nice thing about being in healthcare, we're, 20 years behind, so we know how this is going to play out.
So, I think about Crossover, historically as being an on-site workplace clinic. You explain why that isn't enough, and I can see, sort of a dinosaur approach because most people are working from home anyway. You're not going to set up a clinic, in their bathroom, carve out 10 square feet. But why, from the, sort of the digital standpoint, from the Sherpa, which was your company, Jay, why join up with a workplace clinic company? I mean, how does that combination make sense?
Well, it's interesting. We both have the same DNA. I mean, we were both about continuity and relationships. Sherpa, for example, every time you use Sherpa, you work with the same team. And we also had the same clients. I mean, we worked with employers almost exclusively. So, to me, it just makes sense. But, from Sherpa's standpoint, we were sort of in a bind whenever we needed you to be seen in person. So, we had to refer into the community. What's nice about, having this being married with Crossover is the fact that, hey, whenever you need to be seen in person, we can send you to one of our on-sites or near-sites. And, at the same time, Crossover being, very much brick and mortar over the last decade, the virtual side of things, is just, you marry the two, and it's kind of a match made in heaven.
So do you expect the made in heaven?
There you go.
Yeah, I hear a chuckle
a little
there. Yeah.
religious.
That
here.
sounds like what the investment banker would say. You know, a heavenly fee.
Yeah.
In any case, so I mean, what's the future of employers in healthcare? I mean, I think about a workplace clinic as either something that you've got a real high-end employer and it's just a way to keep people there as like a little extra benefit, or it's like a workaround because they're not getting what they need in the community. How's that sort of attitude is evolving?
Yeah, I think it's a great question. So historically, the on-site, near-site clinics have all been based on a convenience access issue.
Right.
That's the problem that was trying to be solved. What we're finding now is there's a whole new generation of employers that are very active in controlling the cost of healthcare. It's one of the biggest parts of their supply chain that's not managed, and so they're really aggressively going after healthcare. So in order to do that, you can't just have these physical centers where care is delivered, because to your point, many of the employees are now remote.
Right.
We work in distributed teams. So how do you provide the care for the entire country? So I think you have to have digital solutions, not only for this generation of employees, but also because of how we work. And that's really just a huge change over the last 10 years. I think that will accelerate. Now the difference is, you don't want that access to just be random.
Right.
You want to have relationships and communication, which have always been the heart of care. And so we go back to this idea that the medical group can and should be the most trusted entity, and now it has to be also one of the most capable entities to earn that trust to provide the care.
Got it. So what are you seeing here at this conference?
Yeah.
Is it what you're expecting?
What do you think?
Jay just moved out to the West Coast. It's like really sort of the fit with this conference
I
here.
drove here.
You drove?
I did.
Yeah,
yes.
where were you coming from?
San Clemente, California.
Very nice.
Yes, which is where
Any
Crossover
speeding
is
tickets?
based. No, I went through Death Valley, and there's no police out there.
Okay,
so,
awesome.
Yeah, it's fine. Yes. No. So what am I seeing here? You know, it's interesting. We've been coming to these things for 12 plus years, and still the conversation is very similar.
Yeah.
Right? And the one thing that I think is so wonderful about what we're doing is, you know, Scott and I are both, we're talkers, but we're mostly doers.
Yeah.
You know, and I'm really proud of what we've accomplished over the last 10 years. And in that, like, yes, we talk about it, but we're actually building, you know, what I think both of us think is the future of healthcare delivery. I mean, it's got to be digital first before appointment first.
Well, Scott, you were always known for your sort of future looking, you know, like big, he had this big wheel around the Health 2.0, and he had this whole way of conceptualizing.
Man, you're going
it.
retro on me.
Yeah,
I know.
Yeah,
Archives.
Exactly. Yeah, we have our whole team of researchers, you know, that was looking into the ancient history and pull that microfiche out and find it there. So if we're looking ahead 5 years, what do you see?
Yeah, for the employers or healthcare?
Yeah, for the employers, kind of the role in healthcare, and you know what's it going to evolve into?
Yeah. So what's interesting is that as healthcare costs continue to rise, they truly are cutting into the profitability and the viability of employers. I mean, they're really feeling this. So I do feel that employers, as a class of buyers, will get much more involved. Now, if you look at the most actively managed healthcare populations are typically in the Medicare Advantage.
Right.
So where that's going to global risk, full management, people like Caramore and others, I do see the employers expecting and getting to a level of, you know, financing in a very similar way with the same expectations on quality, outcomes, and demonstrating the value that you can return. So we're preparing for that future by building in capabilities now, analytics, predictive modeling, to actually go after the people that need us most, to add services like transportation and other things that add convenience and access for people to get the care they need. I think the employers will get there over time, and we're preparing for that future today.
Outstanding. Well, I want to say thank you to Scott Shreeve, CEO of Crossover Health, and Jay Parkinson. I'm gonna upgrade you again.
Yeah.
But CDO I think is good. Chief Digital and Design Officer.
Oh,
That's
DDO.
not to be confused with the CXO, the Chief Xeroxing Officer, which is an old concept now. In any case, you can watch the whole series here from Health 2019 on your YouTube playlist, or listen wherever you like to listen to podcasts. Most importantly, subscribe to CareTalk so you'll never miss another episode. Thank you.
Hey there, listeners. Want more CareTalk? There's more to be had in our other episodes, so be sure to look for those and subscribe to CareTalk on your favorite service.